So when does one really need spine surgery? Well, they all say that most of the spine patients and back pain patients usually get better with medicines and physiotherapy, which is the truth. 90-95% patients get better with medicines and physiotherapy. Then which are those 5 or 10% patients who really need spine surgery? Let's discuss in this video. Welcome to my channel Zen Spine English. My name is Dr. Rakesh Dhake. I'm a consultant spine surgeon working in Mumbai. Now first let's talk about patient who has a problem in their discs or the nerves are compressed in the spine. The problem has started since last week or so. Usually for such patient we start with medicines or physiotherapy. We check their power in the feet and their legs. If all is good, then we just focus more on physiotherapy and medicines. These patients usually get better in matter of days or weeks, and then we focus more on physiotherapy or rehabilitation to get back to their routine. Sometimes these patients don't get better with medicines or physiotherapy, in which case we may suggest a spinal epidural injection for them, which may solve their problem and they can get back to their routine. But sometimes despite of injection, they might not get better and the problem persists. In such patients, having failed the conservative treatment with medicines, physiotherapy, injection, that is when we suggest surgery for these patients. Also, when we talk and discuss with the patient, we put forward all the risks and benefits, and then they have to decide for themselves. If benefits outweigh the risk, that is when we go ahead with surgery. If suppose the same patient comes to us with back pain, leg pain, and some weakness in their feet, or loss of sensation, or their great toe is not moving, or they have lost control on urine or back passage, or they have some abnormal sensation in the private parts. In such cases, we usually advise surgery, because if the weakness is acute and the pain is present, acute meaning last few days or weeks, in such cases usually surgery will be required to remove the pressure on the nerve and prevent the neurodeficit or weakness from getting permanent. Now next condition where they require surgery for sure is cauda equina syndrome. Cauda meaning tail, equina meaning horse, and syndrome meaning some symptoms or signs resulting from compression of these nerves in the lumbar spine. So when these nerves get compressed due to an acute large disc or some pressure on the nerves, these patients can experience severe back pain going down their legs and problem in their private parts, which might mean abnormal sensation and they can't feel their private parts, or they might lose control on urine and back passage and have incontinence. In such cases, it usually is a surgical emergency where they need to get operated in 24 to 48 hours. Another condition when patients do need surgery is compressive myelopathy. Now, word itself is self-explanatory. Compressive meaning because of compression, myelopathy, myelo meaning spinal cord, and pathy meaning pathology or problem. So when compression on the spinal cord is resulting in a problem, that is when these patients need surgery. Now, these patients usually present with pain in their neck or back, along with radiating pain down their arms. They might have weakened hand grip. They might drop objects from their hand. Their handwriting might change. They might not be able to do fine motor activities like buttoning and unbuttoning their clothes, or using fork and knife, or eating rice with their hands. So all these fine motor functions might be affected. Their balance might be affected. They might not be able to walk straight. They might have a tendency to fall. So all such symptoms are suggestive of compressive myelopathy in the cervical spine, and also in the thoracic spine. If they have, balance might be an issue, and some funny feeling down their leg or sensation in the legs might be an issue. In such cases, we usually recommend surgery, and the role of surgery in such case is to prevent the progression. That is the main role why we are having surgery here. And then slowly as the days, weeks and months pass, these patients usually recover. So they don't recover immediately after surgery, but surgery is done to prevent the progression and prevent the disease from progressing, so that the patient is not bedridden or wheelchair ridden. Another condition is if suppose someone has sustained a trauma or an injury to the spine and they have fractured their spine and there is an unstable fracture. In our language, we say type B or type C fracture. Unstable meaning the front, middle and back part of the spine has fractured and is malaligned or displaced, and the spinal cord that passes from the spine is at risk, or that might be damaged at the time of injury as well. In such cases, we have to put screws and rods above and below the injury level to give it a support, align it properly and let it heal in that alignment. So in such cases, surgery is required. Another condition is when there is an infection in the spine. Now, infection in country like us, India, tuberculosis is very common, but there can be some other infection like pyogenic infection from other organisms that can go in the spine and cause infection, which can form pus in the spine and press on the spinal cord, which can result in weakness or problem down their legs and hands. In such cases, we have to remove the pus and decompress the spine so that we can save the spinal cord from further damage. Also, in such cases, if the microorganism has eaten up the bone and destroyed the spine may collapse and there might be a deformity, which itself can press on the spinal cord and result in paralysis or paraplegia and also weakness in the legs. In all such cases, surgery will be required. But if there is no neurodeficit, there is no weakness, the infection is at the initial stages, in such cases, we might just get a biopsy from that, send the sample to lab, know what is the organism, and then treat it with antibiotics. So these are in general a few conditions where the patients need to undergo spinal surgery. And I hope this video has given you some information about the same. If you like this video, please do not forget to like and subscribe the channel. If you have any doubts related to this topic or anything related to spine, please write in the comment section below and we'll get back to you as we get time. Or you can also send us WhatsApp on the below number and we will get back to you when we can. Thank you so much.